Essentially, the difference is that DOs or osteopathic physicians, they have slightly, very slightly different training, which would involve learning about osteopathic manipulative medicine. Their treatment philosophy is slightly different with a heavier emphasis on things like prevention and holistic care, trying to incorporate diet and lifestyle advice, trying to take a non-prescriptive approach to healing someone when possible. Not that they wouldn't prescribe medications, but if they can figure out a way to help someone where they're targeting more of the root cause of the problem as opposed to just mitigating it through drugs, they'd probably try to do that.
I think if you ask patients, they don't know the difference between MD and DO. They know that that you were certified to practice medicine here in the United States. You take the same board exams. I should say the residency pathway has been merged. You are licensed the same ways by the state medical boards in whatever state where you practice. So they're more similar than they are different. The difference is that's not true worldwide. So some countries recognize full practice rights, others not as much. In the United States, there's not a huge difference. It's also, there's a little bit of additional training that DOs do around osteopathic manipulation. I'll give you a quick anecdote. I once listened to a DO who was a flight surgeon in the military. And he said, look, if a pilot came to me needing help with back pain and I was an MD, all I could do was prescribe him medication and he'd be out of flying for a week. But he comes to me as a DO and I can, through osteopathic manipulation, help alleviate his back pain. He's up and flying the next day because I don't have to write him an opioid prescription that knocks him out of service. So there are reasons to prefer being a DO. I'm not saying you should or shouldn't, but there are that additional training matters in a wide variety of circumstances.